The Neonatal Intensive Care Unit of the Maamobi General Hospital has numerous challenges that require urgent attention. The premises is congested. Besides, the facility does not have enough functional incubators, radiant warmers, and other essential kits required for clinical care for preterm or premature babies. Some of the mothers whose babies are on admission are also not able to pay for their essential commodities and drugs. Sarah Ofori brings us more.
Beyond the clinical care for premature babies, the Maamobi Neonatal Intensive Care Unit also cares for babies born with neonatal sepsis, aspirated pneumonia, and birth asphyxia. Some are also jaundiced babies. With a total bed capacity of 14, 3 functional incubators, 2 radiant warmers, and 9 bassinets, the NICU is challenged when it has more patients to deal with. Some of the expectant mothers who gave birth at the hospital either do not have NHIS cards or are not regular clients of the hospital.
They actually have to buy their baby's items themselves. So they have to get their diapers, wipes, and then other baby items like the soaps and other stuff that you use for their essential newborn care. They have to provide that. And then they need to get their drugs as well. So with health insurance, it subsidizes the bill a little bit. But some, as I'm saying, are non-insured. And then some too are non-attendant, so they don't even come to antenatal for them to be informed that they need the health insurance to support them.
The unit badly needs a bigger space and essential tools to work with.
It's just an open, small space, and then we would love to have a bigger space where we can demarcate babies who have cultured certain organisms. Those who are critically ill at least should be at a different side, and then those who are recovering should also be in a different. That's the ideal setting, but we don't have that here. Though we are trying our best to do our barrier nursing. We think if they expand the NICU, it will be best. And then we do a lot of resuscitation as well. And then with newborns, you need to manage their temperature regulation. So our radiant warmer 2 actually is not enough. We are trying our best not to pair babies due to infection. So if our incubators are full, we tend to refer some. And then now referral is a challenge. So we tend to manage all the preterms and the radiant. So meanwhile, the ideal is to be in an incubator. So if they can also get us an incubator, we'll appreciate. And we need pulse oximeters to monitor their oxygen saturation levels. And then we get a lot of neonatal jaundice, so always trying to get a sample from a newborn's vein is not an easy task. So if they can get us a bilirubin machine that we can just stick on their skin and then get the bilirubin levels, I think that one too will help us.
The hospital is appealing to governments and donors to come to its aid. Sarah Ofori, GBC News, Maamobi General Hospital, Accra.